Okay, we are going to be recording today's session as we always do, which we will post on our website. And we might as well, let's get started as soon as I confirm that we are recording, and we are. So welcome everybody. Today we are going to do a quick tour of what's happening with this cancer surveillance program, which you'll see the acronym CSP proposed study. And we're going to talk about the limitations of the proposed study and its implications if it were to go through, and the importance of obtaining a proper or the importance of a proper cancer surveillance study. And we'll also offer a discussion of what is a better path. And of course, we'll do our Q&A at the end, as we always do. So thanks for joining. Let me admit somebody. Okay, we are March 1st, so here is an update on the foundational elements that are in delay. So this is updated. So we're an average of 13.3 months in delay, again, of foundational health study elements that the CAG feels are part of a critical path to the type of complete health study that this community not only needs, but also deserves. So today we're going to talk about the Cancer Registry Study. So some foundation on the Cancer Registry Study. Whether you're aware of it or not, all cancers are required to be reported to a centralized database, and it is maintained on a county level. The DPH, the CAG, and the SOC is Scientific Oversight Committee members, have met with the USC team, the Cancer Surveillance Program team, and they control the database. And the good news is not only do you have many of the CAG members that were present in this subcommittee meetings with the CSP group, but also Dr. Nordella, a former SOC member, is also on the call today. So we can hear from a clinician on his perspectives of the proposed study as well. So the third bullet point is really, really important that you understand this foundationally. The CSP is under state control. I believe it's the California Public Health. So it's under state control, and they dictate literally how CSP team can analyze the cancer repository. And the most limiting constraint that the CSP is under is that they must use all of LA County as their reference group to take a look at a community and compare it to make any sort of understanding if there's any anomalies or what have you, good or bad. They have to compare it to all of LA County. And this creates a very large problem with this methodology. What it creates, and you'll see this a lot, is when people talk about air pollution and other things, is they handle pollution through dilution. And what we mean by that is if you compare, say, an exposed group, and we use Aliso Canyon exposure as the example. If you compare the exposed communities to those that are unexposed and exposed, so that's important, the combination of the blending of the two groups into a control group, it doesn't isolate the factor that you're trying to examine. So in this case is the exposure of Aliso Canyon. So thereby it dilutes or homogenizes, if you will, the differences between the control group and the test group. And this is a bad thing because it doesn't allow the illumination of the element that you're trying to focus on. And Dr. Nordella was quick to pick up on this, and he posed a really important foundational question to the CSP team. And he simply asked, what have you guys ever found in LA County using this methodology? So they have over 30 years, it might even be close to 40, but for sure 30 years of data. And they've only found one single community impact that demonstrated that there was an adverse reaction to a high propensity of cancers in LA County. And that was the residents living near the diesel truck routes in and out of the port of Long Beach. So they get a lot of contaminants. And that's the only incident Forget about Santa Susana, forget about anything else you can think of, Carson, any of those areas that have high petroleum refineries, et cetera. They've only found one. They also acknowledged in our several meetings, and this blew me away, that this same methodology, this dilution that we're referring to, has only manifested a handful of situations where there's cancer clusters, let's call it. They don't like that word, but that's something that we all understand. A cancer cluster for a layman is, we get it, the preponderance of cancers in that community that shouldn't have it. And they have acknowledged that there's very few incidences in the US where using this methodology has uncovered problem areas. So we're not confident that this is a good approach to look at the situation. If you bear with me, let me try this analogy with you. So if a tobacco company went out and promoted on college campuses, literally in an effort to promote smoking, and they told through social media, they were pushing, hey, there's a new study out, and the results say that smoking's not as bad as we thought it was. But then if you read the fine print, you would understand that they took the test group of smokers and they compared it to a blended group of smokers and non-smokers, right? So this control group suffers from what we're referring to as dilution. And therefore, it makes it look like, assuming this assumes that it makes it look like smoking's not as bad as if it were compared to non-smokers only. Makes sense, right? Okay. So why should we support the same flawed design for Aliso? Right? This is close proximity to Aliso. This is test group, us, versus a control or reference group, they like to call it at the CSP, of all of LA County, where they are not only close to other gas and oil, but they're distant from gas and oil. And this becomes, if you do a study like this, right, you suffer from the dilution. You can't more clearly identify the differences of the control of, excuse me a second, let me let somebody in. You don't clearly examine the thing that you're looking for, and that's the impact of a proximity to Aliso Canyon. So if this study done this way, you're not going to get that differentiation, right? It's not as clear. So if this study comes back and says, hey, it's not so bad, it's not that bad living close to here, just like it's not so bad for smoking when you compare it to a blend of smokers and non-smokers. What do you think the gas company is going to do with this information? Even if the footnote says, this isn't conclusive, this isn't definitive, the gas company is going to take this and they're going to plaster it in front of us every chance they get when we ask questions about the emissions or smelling something or more nosebleeds or more migraines. They're going to use this against the community to perpetuate its existence. The CAG wants a cancer research study done, especially with this, because it'll be retrospective. It could be done in a matter of months. So why is this important when they do the LA County? This is a map of LA County. And it is, the little dots are gas and oil operations. Whether you knew this or not, LA County is a pincushion of gas and oil operations. So to compare Aliso, which is up here in this, whoops, let me point over here, up in this area here, to all of LA County, you see the dilution? Make sense?
Craig, minor clarification. This really is LA City, this map, because the border here up at the top is really Santa Clarita, as opposed to the county, which extends up to Palmdale. So it's really the city, but nonetheless, your point of emphasis is still very clear.
Okay, thank you, Andrew. And the population would be here. The majority of the county population would be in the LA City. That's a really good point. We should probably update this with the county map. Thanks. So again, the CAG wants the proper cancer recurrence study of Aliso. And the proper way to do it is to, just like you would want a smoker, non-smoker, close to Aliso compared to a control group that is distant from gas and oil. And then you can pose the question, or as the statisticians would say, the null hypothesis, and that's how they would typically go about these studies. And the question that you're trying to answer is, are those living in close proximity to Aliso just as safe as those living far away from gas and oil exposures? If we do it the way the dilution method is, all this would answer is, if you live in close proximity to Aliso, how do you compare to all of LA County? It doesn't address the question, are we safe or just as safe if we live close to Aliso to those that don't live close to gas and oil? We took this to DPH and we asked them for a proper proximity study, right? Because that's what it is. And we suggested it could be done immediately, because all this data already exists. They don't have to go gather any data. It's called secondary data. So this is a matter of getting a data dump, giving it to a statistician, throw it through statistical software packages that are readily available, and grind through it and take a look and come to conclusions about, do we have anomalies? Okay, do we have anomalies in certain cancers? So this study can be done easily, and we insisted that it be done by an independent, mutually agreed upon research firm. And we would demand that there be complete transparency to all data, methodology, and results. Simple. We want it. Let's do the design properly. No reply from DPH. Nor has DPH, to our knowledge, brought the request to the SOC for their consideration in future planning. And that's the best we know, because remember, they removed Dr. Nordella, who was our the CAG, the SOC's liaison to the CAG. And you know, we do not believe to date that the SOC has this under consideration for future study. Let's see, Dr. Nordella, did I miss anything? Feel free to unmute yourself, or other CAG members if I missed anything. Did we lose Dr. Nordella? Yes, we did. Okay. Hopefully he'll call back in. Oh, there he is. You're unmuted, Doctor. All right. Okay. Some of you may be on the list of updates from DPH. And DPH sent out a note saying that it's up to the CAG to follow up with the CSP on their preferred path. Okay, and they just sent this out 10 days ago. And it's like, okay, how are we supposed to be following up with the CSP? Because DPH, as we shared with you before, has disbanded all CAG subcommittees. They're gone. There were several of them, and the cancer research one was one of them. And I have to make sure you all realize there has not been a conclusion to any one of the subcommittees. None of them came to a conclusion, yet DPH disbanded them unilaterally. Didn't ask us our opinion. So therefore, we feel that, again, you've heard many of these before, but moving forward, we should demand as a community that we get the chemical list, which we all agreed on, we've talked about before. We've talked repeatedly about how the evaluation must be about the people, and that we should not accept an environmental risk assessment approach. It's like, well, we looked at the chemicals in the air, right? And we don't think it was that damaging to you. So there's nothing to worry about. I mean, that I'm exaggerating to make a point, right? But that's what an environmental risk assessment is. And we're very soon going to be hearing, okay, Dr. Nordella is going to come back in here. So we're going to see really soon a goals and priorities is published by the SOC. And we need to take a very critical look at that when it comes in. So not only do we not avoid the risk assessment, environmental risk assessment approach, but we should demand immediately, because it doesn't have to be 3 years from now. You can do it right now. We could look at the empirical data, and I'm trying to let people in, bear with me, and demand that they do the proper proximity study on the cancer surveillance. just want to remind you of where we are with this. Again, this was another factor, because remember, this whole series is to bring you up to speed on why we feel that we were lacking confidence in the approach that DPH is on, or path that they're on. So to remind everyone, the last vote was in February, and 9 of 11 voters said they were not confident in the path that the DPH study was on. So what can you do? Send an email. Here's a list. We're going to get this on our website. I don't think we did last week. We got to do that. If someone can remind Melissa or Andrew, that would be great. Dr. Nordella, I think you're back in. I don't know how much you missed, but did you want to add anything to your concerns about this methodology? Your mic's not turned on, sir. Okay, as soon as Dr. Nordella can figure out technically where he's at, I'm sure he'll join, he'll chime in. CAG members, anything else? Did I miss anything?
Craig, this is Mary. I don't think you missed anything, but I think it's important for the community members to know, you know, these town halls, we've laid out quite a few serious steps. What's really alarming and frankly surprising, and I would say very immoral about our public agencies, is that they can get this data. They can demand it. You know, the chemical list may be a little more complicated in that they have subpoena power, but this cancer study, you know, this information is available. And I think I speak for most of the CAG, then when we find these things out, and how easily available the data is, but there's all these kinds of restrictions about how it can be used. It's not centered on the health of the community. And we need to, as community members, we need to scream about this, and we need to scream loud because it is so wrong that everybody's health is being marginalized and set aside because of bureaucratic entanglements, and it is beyond disheartening. So just everybody needs to email, you know, the people on that list. Everybody needs to demand it. It needs to be a large community outcry.
And all along, the public agencies, they had the opportunity to be testing, to be collecting data. And a lot of the data that they collected was either flawed or was collected from SoCal gas. And that's a very serious thing. OSHA even put on their website, oh, here's benzene levels, but there's nothing to worry about, your pretty little heads. We got this from SoCal Gas's website. So this is why we have a problem with public agencies.
Yeah, thank you, Patty. Thank you, Mary. We went low tech. I think I have Dr. Nordella on my speakerphone. And Doctor, did you want to add something? And then we'll get to Q&A.
Can you hear me at all? Yes?
Yes, I hear you.
Okay. So yeah, so I listened to what you had talked about before and agree with it 100%. I might just state that, you know, as we went through this, I worked with this agency prior to the SOC, and we had the same problem. So it's a history. I think the things that you might have left out on that is that they have no other mechanism of evaluating this type of data unless it is brought with a formal paperwork and also payment. So this is how they function. When asked why they don't do other evaluations, basically is that it's not up to them, the science people, it's up to the people who supersede or who govern this, which is very kind of upsetting. in the sense that it's like, well, who is that? Who are those people? And of course, that was never really disclosed. So this is the only mechanism. And as when we went through this and said that this is not going to answer the community's question. The issue is that increased incidence of disease. And then of course, they went to right away, well, it doesn't matter even if you have increased incidence of disease because you can't really prove that it's the gas company or the leakage. And it's like, well, that's not the issue right now. Let's do one step at a time. Let's look at the community and see if there's increased incidence of disease, which was a concern. And then when I used the word cancer cluster, it really created a lot of shakeup. And it was like Paul Simon basically was stating that we don't use that term here. It was kind of like a little bit of a foul language, I'm not sure, but it just got a response that was very impressive to me. And it was like, well, call it what you want, increase of illness within the community. So the bottom line is that this mechanism would not answer your question. And they actually agreed with that.
They did.
And so did Dr. Simon. Now, from there, what happened was that I was to the mindset of abandonment. Let's go back to the SOC, fill out the proper paperwork, and pay to do a study modeled after Lisa McKenzie's, of which she did in Colorado. And that was the issue with the links of where the people live to oil and gas and the incidence of disease. So she obviously got that in some form or fashion. So the last point is that they had never presented that to the SOC as long as I was there. And I don't know if they've had another meeting now, but if so, I've only missed one meeting. So I think it's pretty reliable to state that this was not presented to the SOC at all. And I think also that Dr. Simon pushed to have the study done as designed, as is. And we talked about it possibly hurting the community. And then he made the statement, I remember, he says, well, we don't want to do that. But yet, it still didn't deter him. So as far as them moving forward and doing this particular model study, I would say that chances are it might get done. And if so, it might be used against you, and that's an issue. Now, if you take that and just compare 5 more seconds, is that what has happened in New York in regards to 68 cancers being a secondary effect of the people's exposure? How did they get to 68 cancers in New York? And we can't even look at multiple myeloma here, which would probably be a one high up on the list. Is just amazing. So again, this is the deception, manipulation, and so forth by the department.
Thank you, Doctor. Yeah, you bring up a really good point. I may have misled you. This proximity study can be done. It just needs to be taken out of the hands of the CSP. As Doctor explained, there's just a formal process that needs to take place, and there might be some fees. This is completely doable today. Let's move on to Q&A, and if any other CAG members want to say anything, please do. Julie, you got your hand up. Please raise your hand. We're a pretty informal group. Julie, whenever you're ready.
Thank you. I was wondering, I know how difficult it is to get the information that you need in terms of cancer clusters. Have you thought about finding out as well, or at least presenting the question about reproductive disorders, miscarriages, abnormality at birth? I mean, this is much broader and it needs to be looked at. Has that discussion come up?
I think that's a question for Dr. Nordell if it came up in the SOC, birth rate or whatever.
If it had, it was something that I don't remember the exact, I think it has been mentioned, but has it been explored any more than just someone having a statement and saying, we should look at this? So again, that was the confusing issue about how Christina and the core group of public health had sold to everybody that we were so far down the road. We were ready, we were this, we were that, and then you have Dr. Davis come by and say, you know, we're at the beginning. Well, this was one of the lines that were discussed at the beginning and had gone nowhere. So that's what I remember of it.
You know, Julie, you're absolutely right about, you know, one of the things, part of county record is birth weights. So you think about secondary data or data you can use right now today, and that's birth weights. Number of miscarriages and other things like that, that would have to be primary. They'd have to go out and find that information because I don't believe that is public knowledge. But birth weights, I understand, are fairly easy to get to.
A lot of feedback. I would think that, let me just finish. I would think that depending on the amount of chemicals that are in the air that we're breathing, that it would have an effect on fertility rate, it would have an effect on miscarriages and so forth. And it seems to me that I don't know how, if you can't get the basic information right now, how it can be broadened. I don't know what good it does to ask the question, but there has to be a relationship, I would think.
Well, I think you raise a really good point that should be brought up in the goals and priorities. That's a legitimate metric, if you will, to use. And that should be part of the goals and priorities that we were supposed to see 2 weeks ago. We haven't seen it. Someone was going to say something when I stepped on.
Yeah, I was. Julie, that some of those questions have been brought up and I brought some of them up. I've been doing a little bit of a deep dive into some articles and there's some studies that show that people that live near petrochemical fields, et cetera, when there's been, you know, serious leakage like that, that it can be linked, or there's a correlation to low birth weight, which then, as you know, being involved in education when you were, it can lead to other issues with children. And I've actually spoken to a number of families individually about that. We're trying to get that information. The hard thing about all this, and if you even refer back to the cancer study, those numbers are available. You know, every, you know, birth weight is recorded, you know, cancer incidences are recorded, you know, children that might be, you know, receiving support services, that's recorded. And you know, so we're asking for just a melding of that information to raise the concern. And that's the frustrating part. No one, you know, this cancer study, other people on the CAG sat on the committee more than I did, but I was involved in it. And it was incredibly frustrating. The people at USC, they were very honest with us about how these things are designed. And I would say that they also, they didn't disagree with our frustration about how to get this information for the residents of the North San Fernando Valley, but their hands were tied. And frankly, that's alarming. You know, now we all know as citizens that a cancer study like this doesn't really study the cancer. It doesn't study the occurrence. And you know, any of us that have dealt with statistics or you know, reports, or you have to delve into that data, it's frustrating. It's unbelievable, actually, that you couldn't connect those dots, or that agencies are actually putting up walls between other agencies and other universities, whatever, on how to connect those dots. We're just asking, look, connect the dots for the health of the community. And we're being told, no, don't connect those dots. And if you, you know, my opinion, it obviously is that CAG meetings were stopped, you know, we were marginalized. We're demanding connect those dots, and no one wants to. So you're right, low birth weight, it's yes, I would say yes.
In fact, there's been many studies on low birth weight in comparison to like proximities to freeways, proximity to gas and oil. The studies have been done. with that exact methodology.
Mhm.
But yet they're not doing one here. Why? Let's get some more questions, more, just let's get some community involvement. I see there's some PRNC folks on the call. You guys aren't going to break any Brown rules. I counted. If you guys have questions or comments, we are going to talk about Thursday's meeting. Gary, anything? Elma, you had some comments in the chat. Would you like to verbalize any of them?
Can you hear me?
Yeah.
Okay. I lived in Porter Ranch back in 2012 and left the community in 2014. While we were living in Porter Ranch, our house was located right along Cessna Boulevard or something, which is our normal route when we walk in the afternoon. And especially during the weekends when I stay in the backyard and do some
Gardening?
no, some exposing my body to the sun, because I thought my being sick has something to do with not being under the sun because I was working. So anyway, I was always sick. I think we live about 1,000 feet away from the blowout. And I couldn't figure out why I was always sick 3-4 times a week. I couldn't work because I was sick and no shaded. So I made a decision to quit my job because I didn't want to get fired, mainly because I couldn't meet the reporting requirements to the corporate office. And that's it. We left Porter Ranch and moved back to Canyon Country, where the air was cleaner.
Okay. Well, I hope you're feeling better. You were obviously very, very close to the facility, and there has been fugitive admissions. So anything's possible. And I hopefully you've advised your physicians of such. Assad, you have your hand up.
Yes. Good evening, everybody. Pleasure to be here with you, and hopefully looking forward to Thursday for an extensive meeting. The agenda, it's posted on the City of LA website. We're having technical difficulties on the prnc.org, but it's being worked out by the city to fix it, but it's posted, and hopefully we will try to get more people to the meeting from our board and get moving. You need all the support, and we are always behind you because you're the elected face and officials that represent us, the other end of the neighborhood councils. Meanwhile, I believe it's overdue for the list, for the chemical list, because without it, it's affecting us, especially at the air monitoring committee, to come out with vendors, to come out with solutions, to come out with an understanding what's the next step for the expanded, enhanced monitoring system. And anything you need, we're here to support you.
Thank you, Assad. We're going to show everybody the link to Thursday's meeting here as soon as we wrap up Q&A. And thank you very much for making that meeting happen. Anyone else? Andrew, did you want to share something?
Yeah, bear with me just a second.
Yeah, sure. Any other questions while Andrew's getting ready? What else would you guys like to talk about, for future sessions? What general issues do you have in mind? We can show, to help prompt you.
Well, I'd like to bring up a point if you can hear me.
Yes.
So, just really quick, and I'm sorry, Andrew, that you might want to start a discussion on looking at it from Department of Public Health's kind of view. And this is the thing that I think came up numerous times and will come up in the future. These people, to Mary's point earlier, these people are in a position of power. And what they do is they look at information that's fed to you, the people. And they look at that and they abuse their power. I don't know, whatever you want to label it as, but they are the people that will make health decisions for you. And they do that by either not disclosing or, and I hate to say this, which I have evidence of such, is blatantly lying to the people on numerous issues. So that is going to be their position and always justification, of which, again, Craig has had the slide for the goal of the Department of Public Health. And if you look at the second paragraph of it, I don't have it up, or I don't know if he does, but you can read it, and it states about disclosure. So you may make decisions for yourselves or your family for your best health outcomes. So if they don't disclose to you, that's on the basis that they feel that you don't need to know, and you will then go in panic or share, or there's some form of negative outcome that will occur by them disclosing knowledge. And their pattern of behavior has been so consistent throughout, I won't even go into it, but it's something that you might want to all start really thinking about, because that's their philosophy.
Yeah, good point.
It's all right. I was talking and to that end.
Yeah, go ahead, Andrew.
Yeah, to that end, what I'm sharing with everyone now is a communication we received, the CAG received about 10 minutes ago. As you know, we've shared before, our monthly CAG meetings are now quarterly. All of the subcommittees are terminated. And what used to be I say fairly collaborative, at least it was more of a facade than it is now, meaning the CAG had a monthly meeting with public health to set the agenda, basically for the CAG to demand updates on the long list of action items that we have showed you that are long overdue. That is terminated. This is what we've received. And while I don't want this to be just a complete rag on public health session for the sake of, emotionally venting, I think it's really important for the public to understand how your representatives, your voices, who have no other motive other than to obtain a health study we truly believe is legitimate, scientifically valid, and something that will benefit the community. This is what we go through and have gone through for 18 months. So if you look at this PDF, this is, and I'll just be very honest, this first paragraph is just placating to us, tapping us on the head. You're so important. I'll read it for those who, or if this is small. It says update from Public Health on the 2021 CAG meetings. As a CAG member, you've all played an important role in the planning of the Aliso Canyon Health Study from the very beginning of the process. Effective community engagement is critical to our collective efforts, and your knowledge of Aliso Canyon is an invaluable resource as we move forward through this important process. That is the patting on the head saying thank you for, actually participating. Here they have the calendar for our meetings, which just take note. Our next CAG meeting is March 22nd. I will tell you, it's at 4 o'clock in the afternoon on I believe that is a Monday. That is a Monday. So once again, they have put a meeting that the public is supposed to attend during the workday for the public. Even though we have shared and the public has shared how ridiculous that is. Yet they've done it again. And in fact, if you see this, they've set every meeting at 4 o'clock. They've also indicated we have to give them a little more than 2 week leeway on agenda items. Public Health will continue to host the meetings and will generally follow this agenda and update, which for anyone who's been on these meetings, the updates are, there are no updates. Discussions on item where the community input is needed. So now they're controlling what it is they care about by what are they defining they want your input on, not what you feel is important or we on your behalf. They'll tell us. Topics of interest to the CAG. Kind of a funny bullet since Craig has shown now, we have showed you in every one of these town halls, the long list of items that we have lots of interest in, like today's topic, the cancer probe. And then public comments at the end for 10 minutes. So they'll take some, they'll give us a survey link. Okay, and the reason I want to emphasize the survey link, okay, for a Google Form survey, is that is what they're going to do to the public for the goals and priorities. They're not going to allow you to just customize your response, give a whatever dynamic response you would like. I'm sure it's going to be like radio buttons. Is this amazing? Is this less amazing? Or is it good? And let you pick because they can control the feedback. I don't think that's appropriate. I know Craig already shook his head. I don't think anyone on this call thinks it's appropriate.
I want to add to that, Andrew, if you don't mind.
Yeah, go ahead. So, I just leave this up. You guys can read this. This to me, as I pass to Craig, this is another one of the incredibly insulting communications that we get while we are fighting this group to provide the community with a legitimate, good, as we'll call it, a gold standard health study. Craig, go ahead.
Yeah, thanks, Andrew. This is, literally, I just saw it in my in basket too. We just got this minutes ago. So the problem with the survey is DPH is going to gather input. I'm not going to know unless Andrew tells me or I tell Andrew what I put down. We're not going to know. So we're not going to see if the majority brought up one topic, and then it's going to be left up to DPH to decide which topic they're going to discuss or not. This is not transparency, folks. This is not being open and partnering. And Andrew is absolutely right. They've already tipped their hand. They're going to do the same thing to the community when it comes to the goals and priorities. They're going to say, answer our survey. You are not going to benefit from one person asking a question that you might not have even thought of, but it spurred another question that you have. So again, no transparency. Is this the health study you guys want? Is this what you had in mind? Certainly isn't what I had in mind.
Fareed has
your hand up. We'll get to you in a minute. Andrew, go ahead, finish your thought.
No, I was just going to tell you that Fareed has his hand up. I'd love to hear from another community member.
Agreed. Fareed, please unmute yourself. I think if you're speaking, we don't hear you. You're on the phone.
How about now?
Yes, we do.
Yeah.
Go ahead.
How about now? Okay, very good. Thank you very much, ladies and gentlemen. And my name is Fareed Shukani. I'm with Viper Networks. we are actually a company that manufactures and assemble hardware for smart cities and software. And we were doing several projects in the West Coast, and we saw the Aliso County problem on the methane gas. And we are actually in the stages now, final stages in finalizing design for the methane gas detection and other gases and other environmental elements also. And that system will be a terrestrial system that will transmit all the results to all the members that's registered. And they will know either their employees, they get to view the system and manipulate it. And if you're just a resident or you're authorized by the city, that you will get the notification and you can get to see all the results of the past detections and the environmental monitoring. We hope to.
No, go ahead. Finish your thought.
Yes. So we hope that will be a system beneficial to the communities and beneficial to everybody. Thank you.
Okay.
One thing to note, it's not just as one thing that I kept saying at all the AQMD, et cetera, hearings I've gone to, it's not just the methane, it's not just the mercaptans. It was all these chemicals, all the carcinogens that we've been exposed to. So if the county is saying, oh, we just want to look at methane and whatever, that is not enough. And that's what the community, why the community is so determined and so insistent on getting the chemical list from SoCal Gas, because we've been exposed to so much more, and those are the things that are causing the cancer, causing all these other things. Methane might be more respiratory, but really is not the major chemical concern as far as I'm concerned.
Yeah, I would agree with Patty. Fareed, can you send whatever information you have that you're able to share to members at alisohealthstudycag.org? Again, that's members at alisohealthstudycag.org. That'll go to all of us.
Okay, very good. I sure will. And the system is expandable. It can monitor, the sensors that you can add to it is unlimited.
Got it. Great. Thank you.
Thank you.
You're welcome.
Any other questions or comments or suggestions of what to talk about? Mark, go ahead, man. Unmute yourself. And Andrew, can you turn off your share screen, please?
Be happy to.
I have a question. Has anybody, and this might be the doctor's question, has anyone done any investigation on the workers that are actually up on that mountain as far as their health?
Are you referring to the Southern California Gas employees?
Yes, that are actually working that mountain.
There was one contractor that I had direct contact with that asked me about his health, and I unfortunately can't go into it, but very sick. I believe, this is speculation, I believe that the other employees that work for Southern California Gas have a employee GAG contract that they will go to their own doctors. And yes, it would be a pool of information I would love. But you have a paralleling group that can be studied in the Los Angeles City Fire Department that is housed up there. So they're part now of the litigation, and then I don't know what's being done with their health evaluation by the plaintiff attorneys.
Thank you.
And there's also Kim Bruno, the CPUC inspector who came down with cancer, and he's suing SoCal Gas.
He was on site during the blow.
He was on site during the well kill.
Do you know what kind of cancer he has?
It was a rare one. I can track it down and send you the information, but it was some rare form of hairy, I'm not
Very
quite sure.
still leukemia.
Maybe.
Yeah. It's a very rare leukemia, which again is a blood dyscrasia disorder, a blood cancer, hemopoietic cancer. So that would be very interesting, but very rare.
Okay. Any other questions?
Yes, please. Anyone who has any any topics that they would like us to explore in the future meetings, we would love to hear from you.
Yeah.
At the Aliso, the email address that Andrew gave you.
And so everyone has it. Our website is located on the bottom of every slide. It's alisohealthstudycag.org. You can, if you haven't bookmarked it already, you should. There's a lot of really valuable information there, including work we've done, outstanding issues, videos to all of our town halls. So if you missed one or you want to go look at it again, watch it again, you can at your leisure. You're welcome to yell at the screen as many times as you like.
Then you know what it's like talking to DPA.
Yeah. We really hope everyone will be at the meeting on Thursday. It will be more of an overarching conversation. If you've been on all of our town halls, if you're going to kind of get a recap of all of those on Thursday, but it's another day, another time. So if other friends, family, anybody you know that you feel needs to be involved in this, and quite frankly, everybody needs to, based on what we know, Thursday is a great opportunity. And again, we thank the PRNC for doing this. And we look forward to them. There's a couple of potential action items on the agenda, and we're certainly looking forward to them discussing those and hopefully pulling the trigger.
Thank you, Andrew. Details are there. We'll post. It's already posted on our website as well. Let me just see a show of hands or comment. Are these sessions of value? Is the community liking what we're doing here? Okay, I got a thumbs up.
Big yes for me.
Thank you, Assad.
Thank you, Debbie.
Okay,
Thank you,
Gabriel, thumbs
Gabriel.
up. Ron, thumbs up. Great. Thank you. Thank you, Debbie Katz. Thank you. Good. Good. All right, we're going to continue these. Please spread the word. Tell your friends. Tell your neighbors. Go to our website. All the prior meetings are posted, as Andrew said. And next week we'd love to hear from you what you want to talk about next. Doesn't have to be just what's on our agenda. All right. So we got 3 minutes. I'll leave it open to any last questions, comments. And if not, raise your hand. We can do it quickly. Julie, you want to go real quick?
Can you hear me? You can hear me now. I was going to just suggest, because some of the members of the Porter Ranch Neighborhood Council, again, in their newsletter today, or the information, it mentions the meeting, the CAG meeting, but it doesn't give the link to click into. I have to go back to an original way back when. It would really be helpful to have it on the information that is being sent out by PRNC. I don't know if any of you that are members can make sure that that happens in the future. It's easier for people, just to click onto it.
Yes, Julie, I'll remind the secretary. She was in a rush in that newsletter. I mean, she's a new, fresh secretary, so she's trying to learn as she goes. But I brought it to her attention after I noticed.
Thank you.
Yeah, noted. Thank you.
Thank you. That's all. Mm-hmm.
We do have a new CAG member, Don Dwiggins. Don, do you want to just say hello really quick? We got 1 minute. Take your time. No pressure.
Hello, real quick. I'm actually pleased to be with this group. I'm a board member of the Northridge East Neighborhood Council and also a board member of the Sustainability Alliance.
Can't hear him.
Yeah.
Yeah.
Louder.
And we got to work on your mic.
What?
You're
Yeah.
very, very faint, Don.
Well, let me see. Let me try this then. Is this better?
Oh,
Yes.
yes.
Yeah.
Okay, good enough. Okay. Yeah, I'm a board member of the Northridge East Neighborhood Council and also a board member of the Neighborhood Council Sustainability Alliance. Basically, they wanted a representative from Northridge East to join the CAG, and so I raised my hand on it. And I'm finding it very interesting. I have a bunch of questions, but I don't need to get into it at this time. And I've talked a little bit with Craig and with Andrew about the possibility of some of the things I know from the Neighborhood Council Sustainability Alliance, that related things that might be of some use. So we'll see what comes of it. And I plan to
Excellent.
attend.
Thanks for joining.
Yeah, and so everybody is clear. Oh, sorry, go ahead, Don, finish up.
No, that was it.
Okay, so everyone knows Northridge East was previously represented by Mike Kaiser, who had to step away from the CAG, as well as my understanding is from the NC. So Don is the replacement for Mike Kaiser, who had been with us since the beginning.
And Mike had to leave because of personal reasons. Okay, so we're sticking to our 1 hour time limit. We're right on time. This is encouraging folks to come and visit and spend time with us. It's only 1 hour and you learn a lot, and we learn a lot too. So I want to thank all CAG members, Dr. Nordella, and most of all, the community members that have shown up. Please, if you like these, share with your neighbors and friends, post on Facebook. It's the same Zoom link every Monday at 5 p.m. Okay. Thanks, everyone.
See everyone next week, or see you on Thursday.
See you on Thursday. Thank you.
See you on Thursday first.
Bye-bye. Okay, bye-bye.
Bye, everybody.
Bye.